Good morning. So we're here today. We're sitting with Patrick Shaw and Gemma Wood. Patrick's the General Manager of Cortijo Healthcare in Spain, and Gemma is the Head of Clinical Psychotherapy in Spain. Lovely to see you guys. So good that you've taken the time to come all this way to come and have a chat with us. We're very grateful. Tell us about Cortijo, Patrick.
Cortijo Care was established in October 2013 to provide a nurse-led holistic approach to addictions, encompassing addictions for alcohol, drugs, prescription drugs, eating disorders, and we also do dual diagnosis, respite care, and given the fact that we have a hospital license, it enables us to carry out many treatments that are overseen by our medical director.
It sounds as though you do a lot more than deal with addicts and alcoholics.
Yeah, we do, and that's the base of what we do. The basis of what we do is around addictions and eating disorders. However, given that we always have two nurses on at any one time, 24 hours a day, and a medical director, and quite a large experienced team, it enables us to use our experience and the full capabilities of the license, the medical license, to look after our patients.
It's lovely to hear. Gemma, tell me about how you got involved with Patrick here.
Well, actually, I moved to Spain just about 3.5 years ago, and I was training as a counsellor. I was trained as a counsellor and psychotherapist before I moved, and recognised there was very limited resources on the coast anyway. So I kind of did a lot of research for sort of 3 years, set up 5 different private practices along the coast, and gained the evidence that an inpatient hospital of some kind of rehab was needed. I worked with all from the ages of 2.5-year-olds in international school all the way up to my eldest patient today, who's been 78. So it was very clear that something was needed more than my outpatient clinics. So with all the investigation that I did over sort of a 3-year period, it gave me the evidence to go to investors and say, look, this is what's lacking on the coast, and I believe if we're the only clinical licensed hospital on the coast, we are offering something totally different with our expertise.
I can tell you, I used to live in Porto-Venus, funnily enough.
Okay.
And I know for an absolute fact that pretty much it's endemic down there. The huge problems with alcohol and drugs, I've witnessed them. I've been there when there's been shootings and people throwing out cars and just the absolute chaos of that kind of lifestyle. Yeah. You must be very busy.
We are busy. From an outpatient and daycare patient basis, we are. We're bringing in more psychotherapists because there's just not enough of me and my psychologist and key worker. From an inpatient basis, we're building nicely. I think on the cost of the soul itself, there's reluctance if they live there to come into residential care because they can see very quickly, I feel better after 3 or 4 days. I want to go back to my own home and I'll just come in every day for treatment. Kind of missing the sort of ability to realise that actually they're going back to the chaos that they haven't actually sort of re-found themselves yet to live in. But when we have people from overseas, from America, from Holland and Sweden, they do the long-term stays. And especially eating disorders generally will commit to the long-term stays.
So tell me about the programs that you run. Tell me how it works.
So because it's a very individualised treatment program because obviously like what Patrick was saying, we do the addiction side and the eating disorder side. We do the dual diagnosis and mental health. So the one thing that offers beyond rehab is that actually once somebody is through the detox or onto the eating disorder plan, we can see within 5 to 7 days where we're going. We can see if there's what underlying issues are there, and is there a mental health issue. So the treatment plans are very much individualised. We have a general treatment plan where it is a group therapy treatment plan which covers holistic group work, art therapy, psychodrama, music therapy, intense sort of process work. and much more creative work. We believe if we can get the creativity and fun into the treatment as well, the humour is a massive part of treatment, so we have to help them find that it's okay to laugh because everything's so serious.
So you take them through a program, whether it be for, I mean, I'm sure there are differences with the eating disorder program, the alcohol program, the addiction program, the mental health program.
Yeah.
But the outcomes, I won't say the outcomes are all the same, because obviously you have successes and failures, we all do.
Yeah.
But at the end of each program, how do you, what happens to them? Do they have an aftercare plan or?
Yeah, I mean, the actual property itself and the team itself is set up in 4 stages. So we have, even the bedrooms are set up to move the house in the stages, so you feel your movement of progress. So we have 4 rooms that are acute care for detox or for very, very needed one-to-one care for anorexia or bulimia or acute mental health. And then once you've got through that acute stage, we move them into a rehabilitation bedroom, which is still of the same quality, it's just less observation, they've got more involvement with the house, and then that point, that could be anywhere between a week, or it could be there, they could be there for 6 months. And then at that point, then we have 3 independent living bedrooms, which means that there's an added in a kitchenette. So in that stage, we're encouraging them to go out more, our key workers take them out shopping, life skills are added into just general day, like washing your own clothes, cooking for yourself, shopping for yourself. Eating disorders will go through the process of being taken to buy clothes, so because their identity of size has changed and their ability to see themselves changed. So we work with that as the body image side as well. And then in that part, once we feel, okay, if they're either local to Spain or they're abroad, we will always make sure there's aftercare by ourselves or who's referred, or we will find a referral to where they live. So we will, if somebody's come off their own back, or the family have managed to get their daughter or son to us off their own back, and they're from somewhere we don't have our connections from in London or from Newcastle or Manchester, we will find their GP to make sure aftercare is set up. So because we run such different programs for different people, some people will not go down the 12 steps. They need or they want the much more talk therapy, therapeutic input, the holistic therapy. We work with an animal-assisted therapy, not equine, dog therapy. So a puppy that actually he is mine. He's been trained to work with the patients, where he goes to group, he comes into one-to-one sessions, very much allows me to see as the therapist what's going on for the patient, because he's quite transparent.
It's interesting, this we've spoken to a lot of people, the ideas of what I guess started as equine therapy, I've heard of dolphin therapy, elephant therapy, dog therapy, horses we did with equine, but there was a whole range of animals, and I know it works.
Yeah.
You know, at Ark, when we do interventions or when we manage people's kind of aftercare and delivery systems to treatment centres, we monitor them all the way through. So I know we haven't worked together yet, and I'm looking forward to doing it. I know we're coming out to see you guys in a couple of weeks' time, which should be great. And sharing of information that we, because we work in a similar, just a little bit different. We have the whole monitoring thing from day one. Right. We have the consequences from day one, and we work with you guys to make sure that they're met. And we deliver them, we collect them, we bring them home, and we run the whole aftercare picture. I can't wait to share that kind of information with you, how we do that. Patrick, Gemma, it's just been a joy to sit and talk with you. Thank you so much. Thank you very much, guys. Thank you.
Thanks to you. Thank you.